Diving's safety record is better than many other sports and activities, but it still has hazards and risks. You can't breathe water, so common sense tells us that being in and underwater presents some hazards and risks. And you've learned some of the risks associated with breathing compressed air. Much of what you learn as a new diver helps you reduce and manage risk. But like most things in life, you can't eliminate it entirely. To reduce the likelihood of problems, dive within your limits. Stay fit and keep your skills sharp. Follow safe diving guidelines, have the recommended equipment, and do as you've been trained, even when it doesn't seem necessary. Remember that under stress, you tend to do what you do by habit, so maintain habits that help you prevent and deal with problems. You're human, so you will make mistakes. Following proper procedures and having required equipment helps offset this by providing a margin for error. With proper diving habits and equipment, you'll have fewer problems, and the ones you do have will usually be small. You'll be better prepared to handle problems quickly and effectively. The next subsection introduces you to basic problem management, but consider that continuing your diver education expands and refines what you'll learn in this course. For instance, it's recommended that you complete the PADI Rescue Diver and Emergency Oxygen Provider courses, as well as Emergency First Response primary and secondary care training, especially if you plan to dive away from immediate assistance by paramedics, lifeguards, and professional dive guides. Most diver in distress situations occur at the surface. You can prevent or control most of these by doing what you've been taught, diving within your limits, relaxing while you dive, and establishing and maintaining positive buoyancy when you're on the surface. If you have a problem on the surface, immediately make yourself buoyant. Inflate your BCD or drop your weights. Stop, think, and then act. Ask for help if you need it. That often avoids a small problem becoming a big one. If you need to help a diver at the surface, you have to recognize that he needs help and his state of mind. Divers who are in control, not panicked, usually signal or ask for assistance. They appear relatively relaxed and move with controlled, deliberate actions. They usually respond to and follow instructions, keep their gear in place, and make themselves buoyant. Divers out of control, panicked, act instinctively out of fear instead of using deliberate, controlled actions based on their training. They will struggle violently and expend tremendous energy staying at the surface, even until becoming exhausted. They typically don't establish buoyancy, but will climb on anything or anyone to keep from sinking. They reject their masks and mouthpieces, have wide, unseeing eyes, don't follow instructions, and have quick, jerky movements. Panicked divers need immediate help because they may struggle until exhausted, then be at risk of sinking and drowning. Follow 4 steps when you help another diver. First, establish buoyancy for yourself and the diver. Ideally, throw or extend something that floats. If you must make contact to help, first make yourself buoyant, then inflate his BCD or drop his weights. Second, calm the diver by reassuring him. And third, help the diver establish breathing control. Have him breathe slowly and deeply to encourage relaxation. If possible and appropriate, give him a chance to recover before doing anything else. Finally, assist the diver to the boat or shore. Even divers in control may need help due to leg cramps or other problems. You'll practice diver toes during training. An unresponsive diver at the surface may have inhaled water, blacked out due to fatigue and exhaustion, had a heart attack, suffered a lung overexpansion injury, or have some other serious condition. He needs immediate help. The primary concerns are to check for breathing and to begin rescue breathing if it's needed. A diver who's floating face down at the surface may be resting or watching what's underwater, but he could be unresponsive. Good buddy communication avoids confusion, but check responsiveness if a diver floats motionless like this for more than a few moments. Assume a diver who floats in an odd position or who panics and then stops moving to be unresponsive. To assist an unresponsive diver, establish buoyancy for yourself and the victim. Call for help to the boat or shore. Check for breathing and provide rescue breathing if he's not breathing. Finally, get the victim out of the water while continuing rescue breaths if they're needed. We'll look at what you do after you get out shortly. Again, you prevent or control most underwater problems by doing what you've been learning. Relax while you dive. Plan your air use with your buddy and watch it closely. And dive within your experience and training limits. You've learned about overexertion previously, but let's review it because it's a common underwater problem. You help prevent overexertion by staying relaxed, breathing slowly and deeply. Avoid strenuous activity. If you start to overexert, you may feel air-starved if you demand air faster than your regulator can supply it. If it happens, don't ignore the feeling. Remember that you stop, hang on to something that you wouldn't harm if you can, like a piece of dead coral in this case. Relax, breathe slowly until you catch your breath, then continue at a reduced pace, or abort the dive if necessary. Your scuba regulator is designed so that if it fails, it free flows like this, rather than cutting off your air. You can breathe from a free-flowing regulator, but don't seal your mouth on it, partly because there's some risk of lung overexpansion injury if the flow's high, but mainly because it may come out of your mouth or flood your mask. Instead, press it to the outside of your lips like this, letting the excess escape. Insert one end of the mouthpiece if it helps, then breathe the air you need by sipping it from the flow, somewhat like drinking from a water fountain. Start up promptly because a free flow will exhaust your air supply quickly, but ascend at a safe rate. Obviously, have the regulator professionally serviced before using it again. You'll practice this skill during Confined Water Dive 4. In the aquatic plant discussion, you learn that entanglement is rare. Fishing line, loose line off a reel, and old fishing nets can entangle, but you can usually avoid the problem by moving slowly, being alert, watching where you're going, and keeping your kit streamlined. If you do get entangled, it's not usually an emergency if you have adequate air. Don't turn or twist. That wraps line around you. Stop, think, and then calmly and slowly disentangle yourself. Get your buddy to help, and if you're severely entangled or low on air, carefully use your cutting tool if that's faster. In rare, extreme cases, you may have to slip out of your scuba kit to clear it, which you'll practice during your confined water training dives. You've already learned a lot about low air and out of air situations. Planning air use, including a reserve and watching your SPG, usually prevents them. Always head up while you still have enough air for a proper ascent. It's better to have a long surface swim than to run out of air underwater. In the event of an out-of-air situation, you have 4 options. One is to make a normal ascent when you still have some air but feel significant breathing resistance. You get more air as the surrounding pressure drops, so breathe lightly and make a controlled, continuous ascent, no safety stop, to the surface. An alternate air source ascent is your best all-around choice. You're already familiar with this and you practice it many times during training. If you're not as close to your buddy as you should be, have no independent alternate air source, and are 6 to 9 meters or 20 to 30 feet or shallower, a controlled emergency swimming ascent, or CESA, is another response. Simply look up and swim to the surface, making an ah sound to assure that you exhale to avoid lung overexpansion injury. You will learn this first by swimming horizontally in confined water with your instructor. Ascend at a safe rate. Keep your regulator in your mouth and keep all your gear in place. You'll learn more in the Your Skills as a Diver section. You would use a buoyant emergency ascent if you were too far from your buddy, had no other alternate air source, and were so deep that you don't think you'd make it to the surface any other way. Ascend just as in a controlled emergency swimming ascent, except drop your weights. You'll exceed a safe ascent rate, but that's better than staying on the bottom. Make an ah sound and flare out your arms and legs as you near the surface to slow down. When you reach the surface in any out-of-air situation, your low-pressure inflator won't work. If necessary, establish buoyancy by dropping your weights or inflate your BCD orally. An unresponsive diver underwater is a serious emergency. The priority is to get the victim to the surface. Use her BCD or drop her weights if necessary. Hold her regulator in if it's in place, but if not, don't waste time putting it back. Ascend at a safe rate, keeping yourself safe because you can't help someone if you're in trouble. If you lose control of the victim, let her rise to the surface ahead of you. At the surface, follow the procedures you saw earlier. Unresponsiveness is unconsciousness or being unable to respond or act coherently. Near drowning, pressure-related injuries, and medical conditions like a heart attack can cause difficulty breathing, unconsciousness, unclear thinking, visual problems, paralysis, chest pain, lowered alertness, cardiac and respiratory arrest. Once out of the water, your priorities for helping someone who is or was unresponsive are: assure breathing. Keep the airway open. Continually monitor breathing. Provide CPR if necessary. Contact emergency care. First, the local emergency medical system, then the local diver emergency service like the Divers Alert Network if there is one for the area. Keep a breathing, unresponsive diver lying level with his left side down. If the victim becomes responsive, keep him lying down. Administer emergency oxygen and maintain his temperature by protecting him from heat or cold. Continue providing care until emergency medical help arrives. If you can't accompany the diver to medical care, write down as much information about the dive and the diver as possible. This isn't an accident report, so provide only information like the dive profile, the emergency care provided, emergency contact information, and known medical conditions. Write only facts. Don't speculate or guess. Anyone who has been unresponsive underwater or in water should have a medical examination. Some conditions, like near drowning, can have serious delayed effects that are potentially fatal. These can occur more than 24 hours later, even in someone who appears fully recovered.